good, happy Thursday morning, May 7, 2020. I'm Riley King, and welcome to this Thursday morning edition of the Riley King Newscast, right here on the Riley King Network. We have a lot of news to get to this Thursday morning, so let's begin. First up, 19 new deaths, all in long-term care facilities attributed to COVID-19 in New Hampshire. Total number of related deaths in state now at 111. Let's take a listen to this video from WMUR News 9.
Chapel Tractor has been in our family since 1955, when great-grandfather Pearlie and grandfather George decided to sell tractors out of their barn, with a work ethic geared towards customer satisfaction.
As state health officials announced another 19 new deaths, all connected to long-term care facilities, they detailed a new plan to test residents and workers inside those hard-hit facilities.
We need to stop this virus at the door. We need to be able to stop it before it gets to the residents.
Brendan Williams of the New Hampshire Healthcare Association agrees.
We need rapid result testing, and we need it now.
New federal testing supplies that just arrived in New Hampshire this week won't offer such a quick turnaround, but the health commissioner says they will allow for a less invasive swabbing test. Shibinette says the test will be sent directly to nursing homes and assisted living centers and will allow employees to test residents.
We're very wary of sending testing teams into facilities that have had no signs of illness whatsoever.
Shibinette says the department is also ramping up testing of employees in another effort to prevent outbreaks. The goal, testing staffers every 7 to 10 days at each nursing home through mobile teams. Employees can now also get checked any day of the week at a state testing center, symptoms or not, by signing up through the state's COVID-19 website. The commissioner says DHHS is also conducting on-site audits to ensure facilities are implementing proper PPE procedures. The commissioner today also credited the department for stopping multiple potential outbreaks by ramping up testing procedures. Reporting live in Concord, Tyler Dumont, WMUR News 9.
Okay, and we go on that video and that report. Coronavirus in New Hampshire, key information. And here is a look at that COVID-19 in New Hampshire. There are 2,740 number of people in New Hampshire who have tested positive for COVID-19. 1,258,51 number of people in the United States who have tested positive. 111 number of deaths from COVID-19 in New Hampshire. 307 number of people who have been hospitalized with COVID-19 in New Hampshire, and 74,200 number of deaths from COVID-19 in the United States. This map of New Hampshire shows you where cases of COVID-19 are in towns and cities, and these are current cases. Let's take a look. Manchester, 378. And this map here shows you total cases in New Hampshire. Manchester, 602. Now let's take a look at this chart here. New cases each day in New Hampshire. In the purple is daily new positive COVID-19 cases. In the orange, new hospitalizations, and in the red, deaths. Then this chart here is current cases. In the purple, current COVID-19 cases. In the orange, current hospitalizations. In this chart here, total cases. In the purple, total positive COVID-19 cases. In the orange, total hospitalizations. In the red, death. And in the blue, recovered. This chart here shows you by age group. This chart here shows you by female and male, and this chart here shows you risk information. This chart here shows you race/ethnicity of cases, and this chart here shows you percent of New Hampshire population. Your common symptoms: fever, lack of smell, cough, chills, and difficult breathing. How it spreads, and prevention tips. COVID-19 hits New Hampshire nursing homes hardest. Some say more federal attention needed. Let's take a listen to this video from WMUR News 9, Charisse LeClaire.
Some work can't stop because our communities need you, which is why we're working to keep you working.
You never got to say goodbye, and you just wake up one morning and you're alone.
Andrew Delisle's mother passed away from COVID-19 on Friday after battling the virus for nearly 3 weeks at Pleasant Valley Nursing Home in Derry. DHHS says of the 111 people who have died in this state, 87 have been connected to long-term care facilities. That's about 78% of the cases, among the highest percentage in the country. FEMA reports 71% of deaths in Rhode Island are related to the facilities and 60% in Massachusetts. Priya Chidambaram is studying the data for Kaiser Family Foundation.
We do see that more states are attributing a higher share of deaths in their state to long-term care facilities, and that is something that we do expect to see increasing.
A devastating trend. Brendan Williams of the New Hampshire Healthcare Association says the federal government has been slow in its response.
I feel frustrated because lives are on the line, and we just feel as if we're not really a priority.
Meantime, for Andrew, it's a personal loss he'll now feel for the rest of his life.
I'm upset. Do I think it could have been prevented? Probably. Would it have been inevitable? The way things have spread and the way things are going on, it may have. I think there's a lot of there's going to be a lot of soul searching.
A difficult time for a lot of families. Meantime, the New Hampshire Healthcare Association says it hopes New Hampshire soon joins other New England states that have made emergency Medicaid funding possible to nursing homes so they can continue to battle this crisis. The governor says that is an option that is on the table right now. Live in Manchester, I'm Charisse LeClaire, WMUR News 9.
Okay, and there you go on that video and that report. And again, as always, be sure to stay with the Riley King Network for all your latest of your COVID-19 information. We are committed to give you all the latest information right here on the Riley King Network of COVID-19. Massachusetts golf courses reopening. Announcement expected Thursday, sources say. Let's take a listen to that video from WCVB Boston.
Protect your business with all-glass germ barriers from Oasis Specialty Glass. We have custom-fit transaction windows, sneeze guards, glass partitions, and more. Stop cross-contamination with an elegant and permanent glass solution. Order now at oasisspecialtyglass.com.
Good morning to you. Now, the golf industry has been lobbying Governor Baker for quite some time, saying they can be open and practice safe social distancing at the same time. Sources tell News Center 5 that announcement could be made later this morning. The debate has become incredibly heated, with some course owners saying they'd reopen in defiance of the state's orders. Governor Baker has said that he's making a decision based on the safety of health of all the citizens in the Bay State. Course owners that golf businesses have been hit hard in the last decade and are struggling even more now, with more than 40% finishing in the red last year, and the golf industry employs up to 25,000 people. We'll let you know as soon as that decision is made later this morning. Reporting live in Wellesley, I'm Ted Wayman, WCVB News Center 5.
Okay, and there you go on that video and that report. Maine hospitals avoid coronavirus surge, but see steep revenue fall. Let's take a listen to that video from WMTW News 8 Maine.
Giving the class of 2020 recognition they deserve. Channel 8 Senior Shoutouts.
The good news for Maine hospitals is they haven't experienced a surge of coronavirus patients. The bad news is suspending other services has cut deeply into their revenue. The flagship hospital of the Maine Health System, Maine Med in Portland, has cared for the most coronavirus patients in the state. In preparation, it purchased personal protective equipment for staff and drugs for virus patients while canceling elective procedures.
So tremendous cost increases.
Maine Hospital Association President Stephen Michaud says statewide, hospitals are losing $250 million a month, nearing the end of a second month.
Any surgery that could be put off, a doctor's visit, lab, x-ray, everything that pays the bills was suspended.
There have been steep declines in patient volume at Northern Light Health's Eastern Maine Medical Center in Bangor and the system's other hospitals. I spoke by Zoom to Administrator Jeff Doran and Dr. James Jarvis, who've led the response.
There's a big hole to dig our way out of. We know that.
Losing 50% of patients by canceling routine hip and knee replacements, plastic surgeries, colonoscopies, and mammographies.
Things like that bring a lot of revenue into healthcare organizations. And those are the very same procedures that we have delayed.
Northern Light is now rebooking the most urgent appointments, such as for cardiac and cancer patients. Maine Health says it will start to do so in the coming days, both chains limited by their stock of PPE. Small rural hospitals like Down East Medical Center in Machias are also suffering financially from cutting back services.
But a lot of patients decided to stay home and cancel their appointments.
Hospital CEO Steve Lale described the losses in a roundtable hosted by U.S. Senate candidate Sarah Gideon, saying it's vital rural hospitals don't go bankrupt.
Not only are we sometimes the biggest employer in town, but it's for economic development, it's almost impossible to recruit a business to town if you don't have a hospital there.
The Maine Hospital Association says 2 installments of congressional aid have covered only 2 weeks' worth of losses.
And if we don't get what I call significant federal relief, and I mean more than has been done, and then sustained as long as this goes on, then we'll absolutely lose hospitals.
Despite the financial toll, Maine hospitals say they're proud they acted early and decisively and contributed to the flattening of new coronavirus cases. In Portland, Phil Hirschkorn, WMTW News 8.
Okay, and there you go on that video and that report. Golf or tennis, anyone? Governor Scott eases ban on no contact recreation and small social gatherings, though COVID-19 cases remain low. Vermont health officials fear spike if residents relax social distancing. Let's take a listen to that video from NBC 5.
After my last luge season, I needed surgery on both my elbow and shoulder. Dr. Eugene Bird in Adirondack.
With no evidence of any spike in coronavirus cases yet, Governor Scott easing the stay-at-home order significantly.
The good news is, because of everything we've done and the sacrifices Vermonters have made, we can now take some steps to restart social visits and enjoy some recreation.
As the governor was still speaking, the Vermont Golf Association was emailing the news. The state's courses may reopen effective immediately, though only Vermonters can play to start, and new rules require social distancing. Tennis courts may reopen now, along with biking, hiking, fishing, and boating, also encouraged. And to ease social isolation, the governor's order allows you to host social gatherings at home again, up to 10 people, preferably outside, and invite those you know well. Vulnerable folks, including the elderly, must still stay home.
By being careful about who comes over, if an illness were to develop, it will be easier to trace and make sure it doesn't spread further.
Though trends look good as restrictions ease, the health department is watching closely for any surge in the virus and plans aggressive contact tracing in the days ahead, which is why organized team sports and leagues, spectator sports, along with marinas and beaches, are still off limits.
It's time to redefine your routine and swap crowds for solitude. And so many of us are desperate to get outdoors and enjoy it right now. But we can't all go to the same place at the same time.
So go exploring, but stay in Vermont, the Scott administration said today, saying it's also too early for tourists to come and visit. The stay-home order is due to expire the end of next week, but expect that it will be extended in part between now and then. Brian?
Okay, and there you go on that video and that report. $5,000 Rhode Islanders to be randomly selected for voluntary antibody testing. Let's take a listen to that video from NBC 10 WJAR News.
Anthony, thank you. Well, it is the eve of some big announcements tomorrow. Governor Gina Raimondo is expected to announce whether the stay-at-home order is lifted and also new executive orders. And the governor says she's ramping up testing. New on the night team, we're hearing from a local doctor about plans to randomly test thousands of Rhode Islanders for COVID-19. The state is sending out letters asking people to voluntarily do an antibody test and a nasal swab.
Yeah, you could get one of them, and it can be done right at a Stop and Shop. The Night Team's Danielle Kennedy live in Cranston to explain this.
Hi, Dana Patrice. This Stop and Shop in Cranston off Warwick Avenue is one of the 4 locations offering that voluntary testing. And tonight, experts say participation is one of the keys to helping this economy reopen. 5,000 Rhode Islanders will soon get letters in the mail asking to be part of a new effort to deal with coronavirus.
This is critical as we think about reopening the economy.
Participants are chosen at random and will be asked to go to one of 4 Stop and Shops to do an antibody test and a nasal swab. Health experts say the goal is to identify who may have had the virus and who has it now.
The million-dollar question is whether or not having had COVID-19 and having antibodies protects you from being infected again. So a lot of us are a little bit worried that if someone finds out that they have antibodies to COVID-19, they're going to assume they're protected. And that may not necessarily be the case. We don't know yet.
Workers at the 4 Stop and Shop locations took part first. Now it's the public's turn.
I think it's a good thing.
I'm all about it. Everything that saves lives.
I would consider it.
If you get a letter, you'll be offered a time slot to get tested. Results take a few days.
That is always and always will be your choice. But I'm asking you to do it because it's the right thing for everyone in Rhode Island.
Honestly, I think they already know that it was here before they're saying that it was, and they're just trying to get a grasp on things.
The state mailing out letters today, a possible step to help get the state back up and running.
I think that people should still be smart and still be social distancing and staying safe.
We have to just make sure before we open up, because I hate to open up and then people start getting sick again.
Now, those testing sites will be set up inside the stores, the 4 locations, 1 store in Cranston, 1 in North Providence, 1 in Pawtucket, and 1 in Newport. Live tonight in Cranston, I'm Danielle Kennedy, NBC 10 News Night Team.
Okay, and there you go on that video and that report. State releases recommendations for a phased reopening of colleges and universities. Let's take a listen to that video from Eyewitness News 3 WFSB.
Make your event the talk of the town with Connecticut Rental Center. From intimate gatherings to grand ceremonies, we rent and install all types of accessories. Stop by our newly renovated showroom in Middletown. Connecticut Rental Center, family owned and operated since 1969.
Look very different when students head back in the fall. That's if they return in the fall at all. Today, the state laid out the very strict criteria that needs to be met before students head back to campus. Channel 3 Eyewitness News reporter Matthew Campbell is above the newsroom now to explain what it's going to take. Matthew, the governor had quite a bit to say today.
Yeah, Dennis, it's like climbing up a staircase, and there are many steps here. Now, first, in order to reopen, there needs to be more tests. Right now, the state is doing several thousand a day. In order for universities to reopen, the state is looking for a total of 200 to 300,000 by late August. So when campuses reopen, it will not be what we're used to. Distance learning will likely be done in many cases because professors and staff could be part of that high-risk category. Then when students actually go to class, 6-foot distancing will be enforced. That could mean smaller class sizes. It could also mean a lower enrollment. And when it comes to dorms, roommates will be treated like family members, so there won't be a need to have dedicated rooms for each student. So this is all going to be very different, and we could see a later opening date. October was thrown out there today. So it seems like everything right now is up in the air because it's all contingent on meeting the criteria for reopening the state.
We don't know today whether the gating conditions will be met in time for a full reopening of campuses in the fall. In particular, we don't know if prevailing health conditions will stay safe enough to warrant reopening. If there's a rise in hospitalizations during the course of the summer, any kind of second wave, the governor may well declare that the various phases have to be delayed and reopening will not be possible.
So schools will need to be ready to reopen, but they're also going to need to be ready to move online at a moment's notice as well. Live above the newsroom, Matthew Campbell, Channel 3 News.
Okay, and there you go on that video and that report. Stocks jump as Wall Street awaits latest jobless claims numbers. Futures contracts tied to the major U.S. stock indexes jumped higher early Thursday, suggesting Wall Street may be set for gains on Thursday after the government's next jobless claims report. COVID-19 mutations could play key role in race to find a vaccine. Let's take a listen to that video from ABC News.
News on coronavirus and possible mutations now. Scientists around the world and here in the U.S. are now trying to track this. And one of the questions, obviously, is there one type of the virus more infectious than another? Here's ABC's Kaylee Hartung.
Tonight, scientists tracking mutations of the coronavirus as it continues to spread around the world. Small differences in the virus's genome have been found. Researchers now trying to determine if one version of the virus is more infectious than another.
The mutations occur to try to improve on a virus's sustainability, which means that it's probably going to be more infectious and more virulent than the previous. But we really don't know.
And this as the race is on to find an effective vaccine. More than 100 vaccines are being studied worldwide. At least 3 human trials now underway in the U.S. Pharmaceutical giant Pfizer, the latest to dose volunteers, as it tests 4 different versions of a vaccine.
This is a virus that we knew nothing about 5 months ago. And the fact that we already have multiple vaccines in clinical trials is cause for optimism.
Some of the U.S. trials hinging on new technology that uses genetic material known as messenger RNA, which, if proven safe, experts hope will effectively trick the body and spark an immune system response to fight the virus. And David, many of these companies working on vaccines are already making plans for mass production. Oxford University, for example, they've struck manufacturing deals with 7 different companies, saying that puts them on track to produce 1 million doses by September. But if that vaccine doesn't work, all that money invested will be lost. David?
But Americans do remain hopeful. Kaylee, thank you.
Hi, everyone. George Stephanopoulos here. Thanks for...
Okay, and there you go on that video and that report. And that does it for this morning edition of the Riley King Newscast right here on the Riley King Network. I hope you all have a great day, everyone. And I'll see you back here in a little bit for a news report. Goodbye, everyone.